Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. What do olive oil, tart cherries, and turmeric have in common? They all have unique health benefits. We'll find out why. This is the People's Pharmacy with Terry and Joe Graydon.
The Mediterranean diet has become the most well-studied eating pattern on the planet. Loading your plate with vegetables and whole grains and drizzling olive oil on everything can help protect your heart and your brain, as well as lower blood sugar, cholesterol, and triglycerides.
Tart cherries and cherry juice have unique anti-inflammatory properties that ease joint pain and improve athletes' endurance. How does cherry juice affect muscle?
Coming up on the People's Pharmacy, the science behind fabulous foods for health.
First, this news.
In the People's Pharmacy health headlines, where you live can make a huge difference in your life expectancy. Americans are living longer overall, but a study published in JAMA Internal Medicine shows that in some parts of the country, life expectancy is dropping. A county-by-county analysis of mortality shows that people in some places live an average of 20 years less than those in more fortunate areas. The disparities have increased since 1980. Much of the difference might be attributed to poverty. This leads to poor diet, fewer opportunities for exercise, and lack of access to health care. Certain other countries, such as Australia, have done far more to provide preventive health care to a large portion of the population and to support people in changing their unhealthy behaviors, such as smoking or inactivity. Life expectancy has dropped sharply in Kentucky and is low in central Appalachia, the Mississippi Delta, and the Dakotas. Places where life expectancy has increased include the District of Columbia, Loudoun County, Virginia, Manhattan, Brooklyn, San Francisco, and parts of Alaska.
Politicians and pharmaceutical manufacturers often complain that the FDA is too slow in allowing new drugs on the market. As a result of such pressure, the FDA has been striving for more rapid drug approvals. But there's a downside to such speed. A new analysis published in JAMA reveals that 1/3 of the 222 medications approved between 2001 and 2010 were found to cause serious safety concerns later on. These adverse drug reactions were not identified during the review process. In many cases, it took several years for the complications to surface. Drugs that were fast-tracked were more likely to have unexpected safety problems pop up later. Even if the FDA requests studies after approval, these post-marketing surveillance projects are not always completed in a timely fashion. That often means that physicians and patients may be unaware of the potential risks of recently marketed medicines.
Parents need to beware cotton swabs. Although many use them to clean their children's ears as well as their own, a new study shows they can cause significant injuries. About 12,500 children are treated in emergency departments annually for problems caused by cotton tip applicators. Often the effect of trying to clean the ears is simply to push the wax down into the ear canal. Using them in the ears can also cause injuries, including perforated eardrums. Most of the problems occurred when children were trying to clean their own ears. The senior author emphasizes that cotton swabs should never be used to clean anyone's ears, and they should definitely be kept out of children's reach.
Health professionals have been telling people for decades that full-fat dairy products such as milk, cheese, or yogurt are bad for the heart. The saturated fat in such products was thought to clog coronary arteries. That's why skim milk and low-fat yogurt and cheese have become so popular. But a new meta-analysis published in the European Journal of Epidemiology suggests that advice may have been misguided. The authors analyzed data from 29 studies over the last 25 years. Nearly 1 million subjects participated in these trials. The investigators could find no link between the consumption of milk or dairy products and heart disease or death. Didn't matter whether people consumed high or low-fat dairy products. There was no increase in mortality. The investigators even detected a slight trend towards a lower risk of heart attacks or strokes among people who consumed fermented dairy and cheese products. Perhaps admonitions to avoid dairy products high in saturated fat will need to be reconsidered.
Pediatricians have been recommending that babies be breastfed exclusively for the first 6 months if possible. One benefit of breastfeeding is establishing a healthy community of microbes in the baby's intestinal tract. The scientists examined microbial samples from more than 100 pairs of mothers and infants. They found that important microbes in the baby's stool matched bacteria in their mother's milk and on their mother's skin. The milk microbes that colonized the infant's digestive tracts were associated with more diverse microbial communities, presumably making for better digestive health. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Olive oil is a staple of the Mediterranean diet, and research has shown that a Mediterranean diet has multiple health benefits. It can lower triglycerides, counteract metabolic syndrome, help prevent heart disease, and reduce the risk of dementia. Normally, we think of all the vegetables, fruits, and whole grains as responsible for these impressive benefits. But olive oil has a distinctive array of fatty acids. Extra virgin olive oil, the flavorful kind, also has a lot of plant polyphenols that seem to be good for us.
The problem is, how do you know which olive oil to buy? What is extra virgin olive oil anyway? To answer these questions, we turn to Dr. Todd Cooperman, founder and president of ConsumerLab.com.
Welcome back to the People's Pharmacy, Dr. Todd Cooperman.
Oh, thanks for having me on, Joe and Terry.
Dr. Cooperman, we love olive oil, but I have to tell you, it gets a little confusing. So there's like extra virgin olive oil, there's virgin olive oil, and then there's regular old olive oil. So what's the difference?
Yeah, big differences. The extra virgin and virgin are most similar. Chemically, they're very similar, but when it comes down to the fine points, is really what distinguishes the extra virgin from the virgin. It's the aroma and the taste. To be virgin olive oil or extra virgin, it needs to be pressed, mechanically. There can't be chemical manipulation of the oil. A lot of just plain olive oil or pomace oil out there, it could even be used industrially, has gone through all kinds of cleaning, chemically. This can only be dealt with mechanically, typically the first press. And then really what distinguishes the extra virgin from the virgin is a taste test by experts. And really to be official, it has to be by a panel of 8 to 12 expert taste testers who are smelling and tasting the olive oil and looking for things like the fruitiness of the aroma and actually some other positive attributes like, believe it or not, some bitterness and some pungency, even in the throat. They need to get certain scores to be considered extra virgin.
Well, I think that pungency actually puts some people off who are not accustomed to consuming olive oil. It does kind of catch you in the back of the throat occasionally if it's really good olive oil, and some people say, "Oh, what is that?"
Right. If that's an issue, you can look for things that are more mild than robust. And so there are different grades out there, and that's typically on a bottle as well.
Well, the reason we're talking about olive oil, of course, is that it's said to have so many health benefits. Mm-hmm. And particularly, we know that the PREDIMED study, which was conducted in Spain, in which people were given, I think, a liter of olive oil a week to include in their diets,
which actually translates to what seems like a lot of olive oil each day, 4 tablespoons. Wow.
Right. I think the liter was for their families had a liter to use, but as Joe said, it did translate to about 4 tablespoons per person.
Well, apparently the PrettyMed investigators have found quite a lot of benefit from people consuming this type of Mediterranean diet. Can you tell us a little bit about that?
Sure. Yeah. So they have found cardiovascular benefit, especially when you're substituting, the olive oil for other saturated fats. There is some benefit in terms of cancer, breast cancer, colon cancer, possibly some benefit even for type 2 diabetics, better glucose control. And there was just a study I read about yesterday, frankly, where, and it relates, I believe, to the same study out of Spain, where they're even showing now a decrease in the risk of osteoporosis-related bone fractures by about 51% reduction among people who were using higher amounts of extra virgin olive oil, which was about 4 tablespoons per day, versus those who were using lower amounts, about 1.5, averaging about 1.5 tablespoons per day.
That's pretty impressive.
Yeah, that's exciting.
Yeah. So definitely reason to use extra virgin olive oil.
Now, we've heard an awful lot, Dr. Cooperman, about problems with olive oil, that some of it's counterfeit or some of it's contaminated, that you can't count on all of the Italian olive oil, that the mafia has been involved with it.
And of course, the extra virgin olive oil, the EVU, is a lot more expensive than other sorts of olive oil.
So you've done some analyses. Can you tell us what you found and what we should be buying when we go shopping for extra virgin olive oil?
Sure. So Consumer Lab went out and purchased 10 popular extra virgin olive oils, and we found that 7 of them really are extra virgin olive oil. 3, however, do not appear to be extra virgin based on taste testing. Now, regarding the question of whether these are fake, no, they're not fake, and that was an interesting finding of our study, is that it kind of dispels the myth that there's a lot of fake extra virgin olive oil out there. None of these were fake from a chemical perspective, because what we did at Consumer Lab was first put them through a battery of chemical analyses, which they had to pass to show that they were either virgin or extra virgin. The tests are very similar for those 2 grades. Then we had an expert taste tester. We didn't have a full panel, but we had one very well-known expert from California who tasted these olive oils blinded, and the laboratory itself is blinded as well to the identities. And it was her determination that 3 of these products contained were probably made from defective olives that may have been sitting around for too long, may have been and had some bacterial growth on them, may have fermented somewhat, and she could tell that from the aroma, which they describe as this term is fusty with an F, kind of like musty. There was a fustiness to these products. None of the other 7 had any defects at all. And you can't have any defects for it to be considered extra virgin.
Well, I found it very encouraging as I read your report to discover that some of the brands that I use regularly were actually in your top picks because they came out at high quality and reasonable price. Would you tell us about those 3, please?
Sure. So as we always do at Consumer Lab, we're looking for quality and we're looking for value, basically the best quality at the lowest cost. And what we found were that the least expensive product with very high quality was from Kirkland or Costco, the Kirkland Signature Organic Extra Virgin Olive Oil. It had these positive attributes of being of fruitiness, also high in polyphenols, and those are key compounds in extra virgin olive oil that probably relate to the cardiovascular benefits, possibly other benefits such as bone benefits, etc. And we measured polyphenols in every product, since that's not something that will appear on the label, so you can see, just how high the levels are. Polyphenols also are an indicator of freshness because they decrease over time, but they also do add some of the pungency to olive oil as well. The Kirkland actually had a very high level of polyphenols. The second one of our picks was Trader Joe's Premium Extra Virgin Olive Oil. That one also, met all the criteria. And those 2 products, by the way, cost only about, I think it's around 10, 11, 12, 13 cents, per tablespoon. So there are other products that we tested, that cost 50 cents per tablespoon that didn't make our top picks. And then the third of our top picks was California Olive Ranch Extra Virgin Olive Oil. Slightly more expensive than the others by a penny or 2, but it also had a very, very nice flavor to it. And it also comes in a smaller bottle than, Kirkland. You go to Costco and you always come home with enormous, jugs of things. The Kirkland product is in one of these large jugs. It's a 2-liter bottle. And the downside to that is that it'll take you longer to use it, and there's more of a risk of it going rancid before you've finished, using up the bottle. So, if you're using a lot, that's fine. That's probably your best bet. If you're not using it as often, you might be better with something that comes in a smaller bottle. And you should always maintain these, in a dark area. Keep the lid tight. You can refrigerate them, but it's hard to. They do congeal, which is natural. So you probably don't want to refrigerate it. But if you take it out for a while afterward, it's okay. And if you use it in cooking, you want to use it toward the end of the cooking because the heat will kind of ruin the benefits of the olive oil.
Does olive oil interact with any medications?
It can cause, I believe, an interaction with blood thinners, and I forget offhand of any other interactions at the moment.
Dr. Todd Cooperman, thank you so much for talking with us on the People's Pharmacy today.
Yeah, my pleasure. Thanks again.
You've been listening to Dr. Todd Cooperman. He's the founder and president of both ConsumerLab.com and PharmacyChecker.com. He writes and comments on consumer health issues. His report on extra virgin olive oil is published at ConsumerLab.com. You'll find a link to it from our website.
And, Terry, we need to point out that in order to get access to Dr. Cooperman's full reports at ConsumerLab.com, there is a subscription fee.
Yes, there is a fee.
An annual fee. I think it's so interesting that the Mediterranean diet has so many health benefits. I mean, we hear a lot about protecting the heart and the brain. Dr. Cooperman suggested there might be a benefit against osteoporosis, but there's also benefits against diabetes, stroke, breast cancer, stomach cancer, kidney problems, depression, retinopathy in the eye, and less arthritis pain. I mean, it's really quite astonishing.
It is very impressive, and olive oil is definitely a contributor. That's certainly what they found in the osteoporosis study.
Well, the PrediMed study, is so interesting to me because 4 tablespoons a day. I mean, most Americans would go, there's no way I can consume 4 tablespoons of olive oil.
Well, you put it in your salad dressing, and of course you do have salad at least twice a day, and you use it to cook your meals with if you're doing any frying or sautéing. So, yeah, it's possible. You do have to work at it.
We keep learning that fat is not our enemy and that the kind of fat we select is really important. So, instead of margarine or perhaps even butter on our bread, why not use olive oil?
Well, absolutely. It's got those great polyphenols in it as well as the healthy fats. And healthy foods that were once considered terrible are now back in vogue. Things like coconut and avocados and nuts because they have good beneficial fats.
After the break, we'll shift our attention to cherries.
What can tart cherries do for you besides taste delicious in pie?
We'll talk with a scientist who's found that cherries may have significant benefits for athletes like marathon runners.
How did they measure the effects?
Should you try this at home? Which is better, eating cherries or drinking cherry juice?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like this podcast of The People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339. Online at uttercream.com.
If you'd like to purchase a CD of the show, you can call 800-732-2334. Today's show is 1079. That number again, 800-732-2334, or visit our website. It's peoplespharmacy.com.
Today we're talking about the science behind healing foods. You've just heard about olive oil. Have you ever thought of cherries as having superpowers?
To find out about cherries and whether they can be helpful for athletes or people with arthritis, we turn to Dr. Malachi McHugh. He's Director of Research at the Nicholas Institute of Sports Medicine and Athletic Trauma at Lenox Hill Hospital in New York City.
Welcome to the People's Pharmacy, Dr. McHugh.
Oh, thank you for inviting me.
Dr. McHugh, you have assembled quite an extraordinary team at Lenox Hill Hospital. And I guess the fascinating question for me is, how in the world did a group of physical therapists, exercise physiologists, nutritionists all come together and get interested in cherries?
Well, I would be the last person to get interested in cherries, I would have thought. About 12 years ago, some people developing a cherry juice drink got in touch with me and wanted me to study it to see if it would help prevent exercise-induced muscle damage or the soreness you get after unfamiliar workouts. You get sore 1 and 2 days afterwards, and you go, oh, what did I do to myself? And it's a normal process, but it's cumbersome. And they thought the cherry juice would be beneficial in preventing that. I've done a lot of research on exercise-induced muscle damage. And I told them it's very unlikely that this will work. Very few things alleviate muscle soreness. And most things that we think work don't work. And so I said, if you want, I'll research it. And we did this. We did our first study. It was published in 2006, and I was more surprised than anyone that it actually showed good efficacy. And from then, I said, well, this is really interesting, and we've pursued further research in the area. Colleagues of mine have done research in the area. One of my colleagues has had 2 PhD students do their whole PhDs on cherry juice and different aspects of its indications for athletes and non-athletes. So it's kind of been a very interesting journey. I'm a muscle physiologist. I'm not a nutritionist. So having ended up in this line of research was basically because, you know what, this stuff works. Let's find out how it works, why it works, and then what areas that might benefit from it.
Well, tell us a little bit more about your research, if you would. How do you know it works? How do you measure that?
So the very first study that we did was we induced exercise-induced muscle damage in the biceps of the arms. So it's a very common model for studying damage to muscles because you can do it and it's not going to impair the person in their daily activities. They're going to have a sore arm.
So you must have had them lifting weights.
Yeah, so we actually have them hold a weight or hold a load in a fixed contraction with the muscle in a shortened position, and then we extend their arm out. So we stretch the muscle while it's contracting. And that's actually what causes the muscle soreness that you get after an unfamiliar workout. So when you go to the gym and you're sore 2 days later, you're not sore because you lifted the weights so much as you're sore because you lowered the weights. So experimentally, that's how we induce soreness. We just do the negatives, as they're called in the weightlifting world. We just do the negatives, and that causes the soreness. And then we see what things can alleviate that. And that's the model that we use that then will apply to people in sporting conditions where they're doing multiple muscle groups and multiple different activities, and they get that same soreness afterwards. So in this first study, we looked at various markers of muscle damage, and essentially the summary was in the 4 days after the exercise, when they were on a placebo, their strength loss averaged over 4 days was about 24%, and their strength loss when they were on the cherry juice averaged 4%. So basically no strength loss on average over the 4 days. And I couldn't believe that, having seen many, many research studies using the same model. To have no strength loss was really remarkable to me.
I trust that's a significant difference.
Yes, highly statistically significant and clinically very, very important. So from there we decided, well, let's look at more mechanisms. So our next exercise study in humans was a marathon study, and it was in the London Marathon. Some colleagues in England that wanted to get involved in the cherry juice research, and we did a study where we measured strength recovery, pain, inflammation, and oxidative stress, and we showed that and we had 10 runners on cherry juice and 10 runners on a placebo, and the runners in the cherry juice had a faster recovery of strength and less inflammation and less oxidative stress. And also what we noted was after people run a marathon, they often get symptoms of respiratory tract infections. So it's not necessarily a cold. It's probably some damage to the respiratory muscles, but they basically develop symptoms of a cold. And we found that none of the athletes on the cherry juice developed any symptoms, and 5 of the 10 athletes on the placebo developed, which is typical, developed these symptoms. So it is that was an additional finding where we seemed to probably some protection against respiratory symptoms.
Dr. McHugh, this research is just so fascinating, and I'm guessing that a lot of our health professionals who are listening are going, oh, and it was placebo-controlled. This is like real science. Holy cow, this stuff is working. How cool is that? But you know what they want to know? How is it working? What's the mechanism?
Well, the first thing, when we did the first study, the food science person on the study developed the drink at Cornell University, and I asked her, what is the active ingredient that is having this effect? And she said, well, she sent me a list of 30-plus phytonutrients in tart cherries that either have antioxidant or anti-inflammatory effects. And she said it's probably because there's such a range of different phytonutrients that any particular pathway through which any one of them acts does not get saturated. So you have multiple pathways and you have multiple effects, and you have a sustained effect of the drink. So that's what we're thinking is, right, okay, we've got these phytonutrients, and what are they doing? They're probably reducing the oxidative stress that occurs immediately after the exercise and reducing the subsequent inflammatory response that occurs. So when you go to the gym and you work out, you get home and you feel, wow, I feel good, I feel strong, I feel like I got a good workout, and then the next day is when you start to feel a little soreness, and that progresses and you become more sore, and especially if it's an unfamiliar workout. Well, so that damage process that causes that soreness it goes on for about 8 hours after your workout. And it's kind of you're unaware of it. And that's when you have some oxidative stress and the beginnings of some inflammation within the muscle tissue that's been exercised. And I think possibly that's what we're seeing, is that we're reducing that secondary response after the exercise. We're blunting it so that the individuals don't develop the subsequent symptoms.
This is rather exciting for athletes. And certainly as someone who knows exactly what you're talking about in regard to that pain after unfamiliar lifting exercises, for example, in the gym, this sounds like, why not? It's safe, it's relatively affordable, and if it can, help my muscles, I'm going to do it.
So for those of us who would like to try this at home, what's the ideal way to do it?
In terms of how much to take? Or?
Yes.
Yeah.
So that was originally when I started this, and I said, okay, we'll do a study. And I looked into the literature, and there was some research showing that healthy individuals eating a bowl of sweet cherries a day had reductions in systemic inflammation. And I went, okay, so a bowl of cherries seems to have some type of medicinal effect that might be of benefit in some circumstances. So I asked the people manufacturing the drink that we were studying how many cherries are in a bottle, and they said approximately 50. And I said, okay, so 50 cherries a day helps eating cherries. They probably destroy some of these active ingredients making the drink. Let's go with 2 bottles a day. And that was the high science of how we come up with our dose for the first study.
How big are these bottles, Dr. McHugh?
So the original study, they were, I want to say 10 or 11 ounces. Now it's 8 ounces of, and this is fresh cherry juice, so not from concentrate. And so all the research, and I think we've 6 studies on the fresh, not from concentrate drink, and that has been 2 8-ounce bottles a day. And all the studies have shown efficacy for whatever we've studied. Exercise recovery, and they're all double-blind, randomized controlled trials. And exercise recovery, arthritis, sleep, we've studied and all shown benefits. And it's been 2 bottles a day for either 3, 4, or 5 days before the exercise insult, if it's an exercise study, and then on the days afterwards as well. So say it's for a workout study, they'll take it for 4 days beforehand, 2 bottles a day, then about 2 bottles on the day of the exercise and 2 bottles on the next 3, 4 days, depending on how many days we do follow-up symptoms on. And so that's been our model. In the arthritis trial, it was 2 bottles a day for 6 weeks, and then a washout period, and then 2 bottles of a placebo for 6 weeks, or vice versa, depending on whether you started on the juice or the placebo. And so that was one where we were monitoring people's symptoms over time, and that showed efficacy as well. So our model with the fresh juice is 2 8-ounce bottles a day. I know athletes tend to take 1 a day and then 2 when they've got particularly strenuous schedule, like back-to-back games. If they know they've got a game on a Friday and a Saturday, they'll probably take 2 on the Thursday, 2 on the Friday, 2 on the Saturday. Otherwise, if they're in their normal routine, they'll just keep it in their diet as 1 bottle a day. The problem is the other one from concentrate drink that we did a lot of research with in England is a very strong from concentrate, so you actually have to add water to it, and it seems to be pretty potent. But if you walk into the store and you see a regular from concentrate tart cherry juice, I don't know how potent that's going to be or how much of it you need to take. So if it's not so potent and it has a lot of calories, you might need to take so much of it that the caloric intake may be, a negative effect of, trying to come up with something for a positive recovery strategy. So knowing what the dose is for all drinks, it would be kind of a challenge. All drinks are not the same. That's one of the things I've learned through this process.
Dr. McHugh, what's the name for this special cherry juice that you tested?
So the product that we first tested is the fresh cherry juice is Cherry Bundy, and the product in England that we've done several studies on is Cherry Active. It's a from concentrate, and the Cherry Bundy is a not from concentrate, a fresh juice.
And the concentrate works as well?
We debate about it with my colleagues in England. I think it probably works slightly less, but essentially it comes down to, as I said, the fresh juice has about 50 cherries in a bottle, and our dose is 2 bottles, so that comes to 100 cherries a day. In the concentrate Cherry Active drink, it's about 100 cherries in a 30 ml dose that you dilute with water to make it palatable. And the dose is 2 of those a day, so it's 200 cherries a day. So with 200 cherries a day versus 100 cherries a day, I think that the 200 cherries a day is probably, it works. It may be that I'm seeing less impressive effects on strength recovery than I did with the fresh juice, and it's probably because when you do it from concentrate, you degrade a lot of the active ingredients, so you have to get a lot more of the product in your serving.
Now, Dr. McHugh, you mentioned that you had tested the cherry juice for people with arthritis.
Yeah.
And I'd like to hear a little bit more about that research. And I've actually read that tart cherries affect an enzyme called COX-2. And for our listeners who may not be familiar with that, cyclooxygenase, it's the same enzyme that's affected by Celebrex, celecoxib. So tell us a little bit about the arthritis study and how well it worked.
So the arthritis study was placebo-controlled randomized trial. I think there were 60 patients. 6 weeks on the juice or placebo, a washout week, and then 6 weeks on the other treatment. And we found that their symptoms were reduced when they were on the cherry juice, and when they were on the placebo, their symptoms were not reduced. It was a statistically significant reduction in symptoms on the cherry juice and no change in the placebo. Now, statistically, we want to know, is the change on the juice different from the change in the placebo? And that was borderline significant, so it wasn't the perfect statistical result. But the interesting thing was we also measured high-sensitivity C-reactive protein, which is a measure of systemic inflammation. And we showed that when they were on the juice, high-sensitivity C-reactive protein, so systemic inflammation, was reduced. And when they were on the placebo, it actually increased, which was probably because we matched the amount of sugar in the placebo versus the cherry juice. And when you just take a sugary drink, it tends to increase your systemic inflammation. But the key thing was the decrease in systemic inflammation, that when you were on the cherry juice, was highly correlated with how much symptom reduction you got. So it gave us a mechanistic answer for why are they getting reduced symptoms. They're getting reduced symptoms because we are reducing their systemic inflammation.
So it sounds like cherry juice is kind of miraculous.
Well, I'm a researcher. My job is to be skeptical, so I keep thinking about, okay, what's the downside? It can't all be so good, but I have yet to find the downside.
So have you started drinking a little cherry juice now and again?
I've been on it. I've been on it since we did the first study. I went, wow, this is quite remarkable. I'm not going to be foolish enough to show that something. Well, we do so much in research that doesn't work. And I usually tell people my job is to depress you because I'm going to show you that what you think works doesn't work. So when we find something that actually works and works consistently, it would be foolish of us if we are athletes or if we, even for just general health, that we wouldn't take advantage of this.
Dr. Malachy McHugh, thank you so much for talking with us on the People's Pharmacy today.
Oh, you're welcome. Thank you for inviting me.
You've been listening to Dr. Malachy McHugh. He is the Director of Research at the Nicholas Institute of Sports Medicine and Athletic Trauma at Lenox Hill Hospital in New York City. His multidisciplinary research team includes physical therapists, nutritionists, and exercise physiologists, as well as orthopedic surgeons and biomedical engineers. Dr. McHugh has been a consultant with the New York Rangers hockey team since 2000.
Oh, my goodness. Tart cherries. How cool is that research?
It is very cool. No question about it. And, tart cherries are full of polyphenols. That's what some of those phytonutrients are.
After the break, we'll learn about turmeric.
Why is this golden yellow spice so popular?
Turmeric is used as a natural medicine in some parts of the world. What's it good for?
Researchers have focused on one component of turmeric called curcumin. It appears to have anti-cancer activity.
We'll also find out what to look for in a high-quality curcumin supplement.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel utterly soft and smooth. 800-345-7339, online at uttercream.com.
To purchase a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1079. That number again, 800-732-2334, or at peoplespharmacy.com.
Today our topic is the science behind fabulous foods with surprising health benefits. Turmeric is a staple of Indian cooking. It gives curry its distinctive color and flavor. Turmeric has also been used for centuries or even millennia in Ayurvedic medicine. Research on a component of turmeric called curcumin shows that it has a lot of potential healing power.
To find out more about the research on curcumin, we turn now to Dr. A.J. Goyal. He's director of the Center for Gastrointestinal Research and the Center for Translational Genomics and Oncology at the Baylor Scott and White Research Institute. He's professor of medicine at Baylor University Medical Center.
Welcome back to the People's Pharmacy, Dr. A.J. Goyal.
Hello. Thanks for having me back on the show. I'm very excited.
It's always nice to have you. Dr. Goyal, let's just start at the beginning, please. Turmeric, what is it? Why is it so popular these days? How do people use it in cooking? And then maybe we can get into some of the latest and greatest research on this fascinating herb.
Absolutely. So now I would love to talk. I mean, this is a topic which is very near and dear to my heart. I've worked over the years on this, and I think I notice that every day there is a growing awareness on the use of turmeric as well as curcumin. So what is turmeric? So turmeric is a root. It's a plant grown mostly in Southeast Asia and some other parts of the world. So people use the rhizome of the root for cooking. So turmeric in itself is a spice. But if you ground up the turmeric rhizome, anywhere between 2 to 5% of turmeric is curcumin. So curcumin is the most active principle which is present in turmeric. So turmeric is a spice, curcumin is a natural medicine present in turmeric, but at very low quantities, like I said, anywhere between 2 to 5%, depending upon what part of the world the plant is grown and depending on the nature of the soil and so forth.
Dr. Goyal, you say curcumin is a natural medicine. What's it used for?
Very important question. So curcumin has been studied. I call it medicine because, to the best of my knowledge, I've yet to find a disease for which it has not been studied. So how is that? So by that, I mean that it has been studied for a variety of diseases, virtually all diseases, but mostly because of the fact it's a very potent anti-inflammatory. So it's been studied for, you name it, from diabetes to Alzheimer's to Parkinson's to heart disease, brain disease, depression, you name it.
Well, what about arthritis? When you talk about inflammation, I think of inflammatory conditions like osteoarthritis. Has it been studied there?
Absolutely. So, in fact, we have done a clinical trial on using curcumin in osteoarthritis, as well as we published a trial on its use in rheumatoid arthritis, which is an autoimmune disease. So, you're absolutely right that arthritis, which is an inflammatory condition, the underlying basis is increased inflammation. So, yes, it has been studied. We have published a trial a few years back, but we are currently doing additional trials, and I know that several other people have studied it extensively in arthritis.
Now, of course, turmeric and its active ingredient, curcumin, have become very popular in the United States, in the West, in the last decade or so. But this is not a new discovery in many parts of the world where it has been part of the diet for presumably thousands of years, but also it's been part of healing traditions. Can you give us a little historical perspective?
Absolutely. So turmeric has been most extensively used. It comes from the Indian system of Ayurveda, which has thousands of years of history. So people have been using turmeric for thousands of years for a variety of indications, from simple cuts and bruises to more involved chronic illnesses. So people have used it for all these thousands of years, but the challenge was that we didn't have the science to back it. All we knew that it's been used in so many different conditions, and each time people have used it, they find medicinal or therapeutic benefit each time. But what has changed, although we have long history in India and even in Chinese traditional system of medicine, which again dates back to thousands of years, turmeric has been used in Chinese traditional system of medicine as well as in Indian Ayurvedic system. So what has changed in the last few decades or in the last century, that owing to all the medicinal or anecdotal evidence or historical evidence we had for the efficacy of turmeric, we began to do more systematic, more sophisticated, more well-designed scientific studies to begin to understand how turmeric or curcumin works. So as a result, as of this morning, when you look up PubMed, which is the NIH's search engine for looking up scientifically peer-reviewed published articles, I looked at this morning, so there are almost close to 10,000 studies, published with curcumin in virtually every possible disease we can think of.
Now, Dr. Goyal, as you've described, people on the Indian subcontinent have been using turmeric in their food for thousands of years, but Americans don't do that quite so much. In fact, we tend to take things as supplements in capsules. And recently, ConsumerLab.com did a review of curcumin supplements. About 33% of them failed the quality review. Can you comment on that, please?
Yes, absolutely. I think that's a very, very important question because to the listeners and people in general, I think this is a very important point. Curcumin, I told you, it has been used traditionally in Indian system as turmeric, as a spice, and people have been using it, and they've been doing this without having all the scientific evidence we seek these days. So they knew that turmeric works, and turmeric is a composition of multiple curcuminoids. So curcumin is one of the three major curcuminoids present in turmeric. So when people eat turmeric, they're essentially consuming all three curcuminoids, and curcumin being the most prominent among the three. So what has changed is over the years we have become, because we knew that curcumin is the most abundant natural medicine present in turmeric, all the scientific studies have looked at curcumin only, which is fine, because it is the most common one. But at the same time, I think we have begun to ignore the other two siblings of curcumin. Like I said, there are three major curcuminoids. So they also offer medicinal and therapeutic value, which we need to consider. So you mentioned about the article in Consumer Labs that not 30-some% of the curcumin extracts failed. The reason being, I think people have to understand the difference that the purity, the quality of curcumin, and the way it is extracted and the way it is reconstituted to increase its absorption is absolutely very, very important. So curcumin has so many wonderful properties, but it still has few challenges. That curcumin is hard to absorb. So once we ingest it orally, most of it does not get absorbed. But that is fine because we have recognized that only small amounts of curcumin is enough to give the therapeutic benefit we need. But we need to make sure that we use high quality, high absorption curcumin. It is not very water soluble, so that's why you want to make sure that the curcumin you use is high quality again. So the bottom line being that we need to use a curcumin extract in the marketplace which is consistent, which is high quality, which has enhanced absorption, and which has been vetted by scientific studies.
In a moment, we'll ask you for recommendations, but I'd like to bring your attention to an article that was published in the Journal of Medicinal Chemistry, the title, The Essential Medicinal Chemistry of Curcumin. And they sort of reinforce the idea that curcumin is unstable, reactive, and non-bioavailable. In other words, it's not absorbed very well. And you've written a rebuttal. So can you tell us a little bit about this controversy now about the medicinal chemistry of this active ingredient?
Yes, and I've read that article and I wrote that rebuttal because I think the actual premise of that article versus the conclusions drawn by the media and some of the readers, there's a disconnect between the two. So the original purpose of that article was to look at curcumin as an example for drug development. So these authors looked at all the data around curcumin, and then they began to put it all together to see what were the challenges or what were the things they learned during curcumin scientific studies and so forth to see how good is curcumin in terms of developing as a possible drug for treating all the diseases. And what they concluded is, yes, curcumin is hard to absorb, curcumin is not very stable, and it is not water soluble, and that is absolutely true. But what is not true, which was a misinterpretation on part of the media and people, the claim that curcumin does not have therapeutic value, that is not true. And one of the conclusions or one of the inferences drawn from that article was that there are no double-blind, placebo-controlled clinical trials on curcumin which have proven successful. And I think these last two contentions were absolutely not true. The reason I say that is I just mentioned a few minutes ago that there are more than 10,000 studies, almost close to 10,000 studies published, which you can find on PubMed. And to the best of my knowledge, again, most of these studies have shown therapeutic benefit of curcumin. And to the point that there are no clinical trials, no double-blind, placebo-controlled clinical trials done on curcumin, that's not true also, because there are more than 80 trials finished using double-blind, placebo-controlled approach with curcumin. And all of these trials have shown positive data, and the level of benefit varies, I agree, but all of these trials have shown positive data. There are more than 300 trials. If you look at clinicaltrials.gov, there are more than 300 trials finished with human studies, combining single-blind and non-placebo-controlled trials with curcumin, and there are currently more than 142 human clinical trials in progress on diseases such as asthma, diabetes, cancers, schizophrenia, pancreatic cancer, breast cancer, radiation therapy, dermatitis, so forth. So much is going on, and then put it together with thousands of years of history showing turmeric and curcumin work. So that was my problem. So if the contention is curcumin an ideal model for drug development? No, it has challenges because it's poorly absorbed and so forth. But saying that curcumin does not work or turmeric does not have any medicinal benefit, that is not true.
Now, our listeners may not be familiar with your research, but you are, in essence, a both basic researcher as well as a clinical researcher, and your expertise is in the field of colorectal cancer. Can you just give us a tiny oversight in terms of what you've done and what you found?
Yes. So you absolutely said it right. I'm a PhD biologist, but I do a lot of basic fundamental research along with a lot of, I call it translational or clinical research. And my work is mostly on colon, but I work within the GI tract. So we work on colon, pancreas, gastric, esophageal cancers, liver cancer, so forth. And over the years, we have published a lot of studies on curcumin on colon, where we have shown that curcumin is a very potent natural medicine for treating colon cancer. And the reason it is particularly more attractive for colon because one of the limitations of curcumin, which I said before, is that it is poorly absorbed. So poor absorption actually helps when it comes to colon cancer because when it comes to colon cancer patients, poor absorption means the curcumin sits in your colon for long periods of time in addition to all the systemic absorption which has happened in your bloodstream. So when it comes to colon cancer, actually it works miraculously well because now you have dual benefits. You get systemic absorption, which is the amount of curcumin circulating in your bloodstream, as well as you have local therapeutic effect of curcumin while it sits in your colon. So we have done many, many studies now, and we have active clinical trials going on here at Baylor, where we have shown that curcumin helps polyp production. Curcumin helps patients who have colon cancer. We have done in vivo studies where we have shown that a combination of curcumin with patients who are already taking chemotherapy for colon cancer, when they combine curcumin together with their chemotherapy, actually the efficacy of chemotherapy is enhanced by combining 5-FU, by combining with curcumin. And also we have shown that curcumin has an uncanny ability to attack something we have recognized as cancer stem cells, because cancer stem cells are the main reason most cancer patients experience tumor recurrence many months or few years down the line once surgically the tumor is taken out. So what we have shown is that curcumin actually attacks your cancer stem cells. So patients who are taking curcumin, it is going to help them not only for immediate relief from their cancer, but also it's going to delay or resolve their chances of getting the tumor back.
Dr. Goyal, if some of our listeners would like to purchase a high-quality curcumin supplement, do you have any advice for them? What should they look for?
So my research for the past many years have focused on a very unique extract of curcumin, which is called BCM95 curcumin. I've used this curcumin in my studies for the last many years for the same reasons. One, it is a very high absorption curcumin. It is absorbed anywhere between 5 to 10 times more than generic garden variety curcumin. So that's one. Second, which is equally important, this curcumin extract combines all three curcuminoids. So I mentioned curcumin is one of the three curcuminoids. but this extract actually comprises of all three curcuminoids, which is good because then there's a potential synergy between these three curcuminoids in terms of helping patients and helping fight inflammation. Third, once you ingest it, it stays in the body longer. So all of these three reasons, it is absorbed better, it has full-spectrum curcuminoids, stays in the body longer, and it contains essential turmeric oils, which is very important because to enhance its absorption, this extract was created in a very unique fashion by combining the essential turmeric oils which are present in the root itself to enhance its absorption, so which makes it all natural. So it's all natural, high absorption, all full spectrum curcuminoids, stays in the body longer. So it's called BCM95, and we are currently doing clinical trials using BCM95 on patients with colon cancers, patients with cervical cancer, and we are using a product called CuraMed, which is sold by Europharma USA, also from Terry Naturally. So we're using this preparation, CuraMed, which is essentially BCM95 curcumin.
Dr. A.J. Goyal, thank you so much for talking with us again on the People's Pharmacy.
It was a pleasure. Thank you so much for having me on the show.
You've been listening to Dr. A.J. Goyal, Director of the Center for Gastrointestinal Research and the Center for Translational Genomics and Oncology at the Baylor Scott N. White Research Institute. He's professor of medicine at Baylor University Medical Center. You'll find a link to his most recent research from our website. And
Dr. Goyal does have an affiliation with Europharma USA. We spoke earlier with Dr. Malachy McHugh, Director of Research at the Nicholas Institute of Sports Medicine and Athletic Trauma at Lenox Hill Hospital in New York City. He spoke about cherries.
We also spoke with Dr. Todd Cooperman, founder and president of ConsumerLab.com and PharmacyChecker.com. He told us about the benefits of olive oil.
Lynn Siegel produced today's show. Al Wadarsky is the engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
To buy a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1079. That number again, 800-732-2334. Online at peoplespharmacy.com.
When you visit our site, you can check out information on prescription drugs, herbal medicines, and home remedies. Share your thoughts on today's show. We'd love to have your feedback.
At our website, you can also sign up for our free online newsletter or the free podcast of the show. You can listen at your convenience or share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
When it comes to Father's Day, dads want steak. And the experts at Omaha Steaks are making it easy for you to deliver uncompromising quality with gifts that are sure to make his day. Plus, get an extra $35 off with code THANKSDAD when you shop at omahasteaks.com today. But don't wait. Father's Day is June 15th. Shop now at omahasteaks.com and get an extra $35 off with code THANKSDAD. Minimum purchase may apply. See site for details.